Hi, I'm Lucas, and I'm going to be presenting on ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a neurological disorder which causes inattention, lack of focus, and impulsivity. You might know it as ADD, or Attention Deficit Disorder, but this term is kind of outdated and only describes one type of ADHD. It's one of the most common mental disorders. You probably know someone or are friends with someone who has it. Um, I'll just keep going. According to CHAD, in 2022, about 3.5% of the population has ADHD, or 11.5 million people. How is this disorder diagnosed? Well, a diagnosis of ADHD is based off of symptoms occurring over a period of time in more than one setting. For example, the symptoms can't just be present at school, or they can't just be present at home. To receive a diagnosis, a person has to be exhibiting 6 symptoms of a specific type of ADHD. If they're 17 or older, they only have to be showing 5. There are 3 types of ADHD a person can be diagnosed with, and the type they are diagnosed with depends on which symptoms they are exhibiting. The 3 types are primarily inattentive, primarily hyperactive, and combined presentation. Combined presentation is a little more difficult to diagnose, but I will get into that later. So, what is the first type? Primarily inattentive ADHD is about what it sounds like. Someone with primarily inattentive ADHD mainly has problems focusing, staying on task, and organizing. Symptoms include avoidance or dislike of tasks that take sustained mental effort, being easily distracted, problems with time management, and problems completing tasks. The next type is primarily hyperactive, which again is what it sounds like. People with this type of ADHD struggle with hyperactivity, or basically constant movement. Symptoms of this type include having difficulty staying still in their seat, excessive movement or fidgeting, and cutting into conversations or not being able to wait their turn to speak. Then there is the third kind. The third kind is combined presentation. Combined presentation, again, basically what it sounds like. People with combined presentation show symptoms for both the previous 2 types. The reason the diagnosis for this type is more complicated is because other neurological disorders can be easily mistaken for ADHD, such as mood disorders, learning disorders, substance use, and certain medications. Diagnosis of this type involves psychiatric evaluation, a complete family and medical history, questionnaires, and extensive questions about the person's childhood, education, and the environment they grew up in. So those are the types. What is the cause of ADHD? The exact cause is not known, but evidence suggests that it is genetic, as well as there are differences that can be seen between children who do have it and children who don't, such as children with ADHD have less gray and white brain matter. Factors such as stress during pregnancy, exposure to substances, and low birth weight are other factors that have been linked to the disorder. How is it treated? Well, the 2 kinds of treatment are therapy and medical intervention. So the most common type of medical intervention is stimulants. What stimulants do is increase dopamine production. There are 2 kinds, which are used as an active ingredient in all stimulant-based medications: methylphenidate and amphetamine. Examples of medications would be Adderall, Ritalin, and Focalin. These are more short-acting medications and typically only last 3 to 4 hours, while a medication like Concerta or Adderall XR are longer lasting, about 8 to 12 hours. And these medications are good for example, children trying to make it through a school day. Not everyone reacts well to stimulants. So, for people who don't react well to stimulant medication, there is clonidine and guanfacine, which are, again, used as ingredients in medications. And what these medications do is basically they just lower high blood pressure. These non stimulants are very short acting and typically require several doses a day. Now, how many people have this disorder? Well, according to CHAD, which stands for Children and Adults with Attention Deficit and Hyperactivity Disorder. I know the acronym does not line up. I guess they were just trying to get it to spell something. But in 2022, about 3.5% of the population has ADHD. 3.5% sounds small, I know. But what that comes out to is about 11.5 million people with ADHD in 2022. So, to summarize, ADHD is a complicated neurological disorder that people often misunderstand or have an incomplete picture of. It can be difficult to diagnose because of the way it can mimic or be mistaken for other disorders, and there are different symptoms and different types, so it can just be hard to diagnose. It's a fairly common disorder. You probably know people or have friends with it, and because it's often misunderstood, in understanding it is important to being able to understand those people and have a proper relationship with them.